Hello, all you healthy blood pressure warriors. My name is David Fry, and I'm the founder of HealthyBloodPressure.com. High blood pressure is a common condition. With mild cases, changing your lifestyle may bring down your levels to the normal range. But if that doesn't work, your doctor would prescribe medication. And there are so many different types of blood pressure lowering drugs. Is one better than the other? Well, some medications may suit you better, but that depends on several things such as age, race, or other health issues. In this video, I'm going to talk about which type of blood pressure medication may be right for you. And the contents of this video are based on an article written by Dr. Sharon Orrange, who is an associate professor of clinical medicine at the Keck School of Medicine. She's associated with the Division of Geriatric, Hospitalist, and General Medicine at the University of Southern California. So let's take a look at some of these parameters and see the possible appropriate blood pressure drugs that will go with them. First, let's talk about choices for young people. Here we're talking about those between age 20 and 50. It's important to look for medications that prevent the risks of stroke and heart failure in the future. ACE inhibitors and ARBS are the best candidates for this group. Now, these drugs are cheap and generally everyone can tolerate them. ARBS have a slight edge over ACE inhibitors because they don't cause dry cough as a side effect. For those who can't tolerate ACE inhibitors or ARBS, beta blockers might be a good option. They just don't prevent stroke as well as the first choice, ACE inhibitors or ARBS. Young people usually don't do well with diuretics, and so this category of medication should probably be the last choice for this age group. Now let's talk about drugs commonly used for people above the age of 60. Those people over 60 need better protection from strokes, and they also need a drug that has a better outcome with long-lasting effects. And for this reason, diuretics are the first line of treatment for older patients. Calcium channel blockers are also a good first choice for this group. ACE inhibitors also work wonderfully in the prevention of strokes, and so do ARBs. So these can also be the first choice of blood pressure lowering meds for those above 60 years of age. Beta blockers are typically not used as the first choice for this group, and this is because they don't offer a high level of prevention from a stroke. But some patients may not be able to take diuretics and ACE inhibitors. For them, beta blockers may be useful in lowering blood pressure. Let's talk about blood pressure meds for African Americans. In 2014, a group of researchers at UCLA and other U.S.-based schools of medicine published a study. And in this study, they found that African Americans typically have a lower renin profile. Renin is the main hormone that regulates blood pressure. Due to low renin, many African Americans are prone to having high blood pressure. And this low renin also makes ACE inhibitors and ARBs ineffective for this group of people. So these patients typically start with diuretics, and diuretics can manage blood pressure well while also having a lasting effect. Calcium channel blockers can also be the first choice of blood pressure lowering drugs for African Americans. Let's talk about those people who have extremely high blood pressure. Now, some people tend to have extremely high blood pressure, and this is regardless of their age or race. Any blood pressure reading that's 20/10 units higher than normal is considered extremely high. This means that if your higher number should be 130, then 150 or more is considered extremely high. And if your lower value should be 80, then 90 or more is considered extremely high. Now, these patients often need combination drugs. Combination drug therapy is when your doctor mixes two different types of meds to get the right numbers. These combinations depend on a lot of factors and require careful evaluation. Your doctor is the best judge of which combination of meds you should take. Let's talk about drug choices for those with heart failure or diabetes. If you've had a heart attack before, the line of treatment changes. This is also true for those who deal with heart failure or diabetes. In such cases, drugs with a better outcome are the first line of treatment. Usually, ACE inhibitors and ARBS are the go-to options for patients in this group. Beta blockers are also a good choice if you've already had a heart attack. So in summary, blood pressure lowering drugs are of various types. Your age, race, and chronic health issues determine the best type of drug for you. But these are just general guidelines. The blood pressure lowering med for you may depend on a variety of other factors, and these include your overall medical history, your genetics, and so on. Your doctor is the right person to decide which is the best drug for you. Talk to your doctor, who can choose the best blood pressure lowering medication based on your needs. Hi there. If you suffer from high blood pressure like I do, and you want to receive my educational videos about how to lower your blood pressure, I'd like to ask you to do 3 simple things right now. Number 1, click the subscribe button right there. And then number 2, click on the bell icon right down there so that I can notify you the moment I release a new video. And number 3, watch another one of my more popular healthy blood pressure videos right over there. Okay, thanks for watching and have a happy and healthy day.